Hi, ladies. As you know, October is National Breast Cancer Awareness Month, so I thought I'd give you a few facts about breast cancer today. There are some risk factors for breast cancer that you just cannot change, but there are some risk factors that you have complete control over, so I thought I'd let you know exactly what those two categories are. The risk factors that you can't change, that you're just born with, the number one risk factor is age. Women over the age of 50 are at increased risk for getting breast cancer than women under the age of 50. And in fact, only about 5% of breast cancer cases occur in women under the age of 50. Some of the other risk factors that you can't change are having the breast cancer gene known as BRCA, BRCA1 or BRCA2, and then also those women who have the dense breasts or the fibrous tissued breasts that have been instructed to get mammograms, MRIs, or ultrasounds, and they need to be checked every 6 months. You too are at increased risk for having breast cancer, as well as having a family history of breast or ovarian cancer. And that kind of goes with the BRCA1 and BRCA2 genes. However, the risk factors that you can change that are completely in your control, and let me be clear, most women who get breast cancer do not have the BRCA genes. They don't necessarily have a family history of breast cancer or any other known obvious risk factors. So the vast majority of breast cancer patients have had no genetic predisposition that they knew of. The number one risk factors that you can change are not being physically active. Women who are not physically active at all are higher risk of getting breast cancer. Also, women who are overweight or obese, studies are showing that they are at a higher risk of getting breast cancer also, more so than women who are at a healthy weight. A healthy weight would be a BMI between 20 and 25. You can find a BMI calculator on the internet, or I can help you with that. So there is a range of a healthy weight. Also, those taking synthetic hormones, not bioidentical hormones, synthetic hormones. Studies have shown in the past that women who take synthetic hormones are at an increased risk for breast cancer. And then also, most importantly and easily, women who drink alcohol. Studies are showing that women who regularly drink and the more alcohol you consume, the higher your risk of breast cancer. So consider that if you're somebody who frequently has a glass of wine every night. Is that glass of wine really worth it? One more factor where the studies are mixed, and that is on stress. Stress, the studies show mixed studies, that stress is a very large contributing factor to breast cancer or that it's not. Now, I've seen studies that say it definitely is and studies that say it definitely isn't. However, the whole point is get out there and exercise. You're going to be less stressed. Drink a little less. You're going to start feeling better. Your gut will be healthy. You will be less stressed. I hope you take this information and you go out there and you decide to make some changes. And if you need help, I can help you. I run the coaching program, Hormone Balancing for Women. I teach you lifestyle changes on how to balance your hormones naturally so that you can decrease your risk. I will have another post soon on how I, as your nurse practitioner, can interrogate your urine to figure out how you process your hormones, specifically estrogen, and I can tell you if you are processing your estrogen down the cancer-causing pathway. Very powerful stuff. So I hope you have a great day and stay tuned for future posts.